Now this is an ultrasound study of 60 years old female presenting to me to rule out a mass felt in the epigastric region extending into the hypochondrium, right hypochondrium. Now you see this is the mass. This is not the full dimension of the mass, but have an appearance of the mass in your mind that it is heterogeneous in appearance, solid, well demarcated with internal hypoechoic areas and as well as anechoic areas within it. It's echogenic but has a heterogeneous appearance. It's a solid mass. Here is the pancreas. This is the splenic vein, this one. This is the superior mesenteric vein, and this is the aorta in transverse section. Now this is the longitudinal section of the liver with this linear curved structure, thin, tiny, is the ligamentum venosum. This is the segment 1 of the liver or the caudate lobe. This is the IVC coursing posterior to it. To notice that the outer surface of the liver is smooth, and secondly that the pancreas is normal. Now where is this mass? Just see the mass first. Have a look at the mass, the appearance of the mass, and the total dimension of the mass. That's it. It extends from the region of the epigastrium to the umbilical region in the midline and extends medially. Now this is the dimension of the mass. Measures 16.6 centimeter by 10.4 centimeter approximately. You can see the inhomogeneity and well demarcation that of the outer surface of this focal mass region. Now see anechoic areas as well as hypoechoic areas within it. These are the anechoic areas, the hypoechoic area within this solid mass, and these are suggestive of internal necrosis. Here you see this is the anechoic area with internal echoes. This is another one. There are few other hypoechoic areas. As such, this is a solid mass. Now coming towards the now this is the gallbladder. It has no relation with the gallbladder. We can see both anterior and posterior wall clearly. Gallbladder is normal. You can see that the liver and the outer surface of the liver is smooth. The right diaphragm is showing normalcy. No fluid is seen anterior to the diaphragm. Kidney. Pass out the left. I'm asking the patient to turn to the left decubitous posture to get a full view of the kidney to see what is its relation. Now, does it relate to the kidney? No. This is the upper pole of the right kidney, and this is the lower pole of the right kidney. Both poles are clear. Kidney is normal, and in it itself, the liver is also showing only fatty changes. Nothing more than the fatty changes can be seen. This is the portal vein. This is the portal vein. And now from the region of the right hypochondrium, if you see, separate but adjacent to the posterior wall. Now this is the posterior wall of the gallbladder. It's separate from the posterior wall, and it's the, now this is the region of the right hypochondrium. This is the portal vein. We see a well demarcated mass, heterogeneous in appearance, with internal hypoechoic areas extending up to the epigastric region, crosses the midline, and we have seen that it's not giving any effect on the vessels in the region. Here you can see the portal vein. This is the portal vein, and as well as we can follow the aorta. This is the aorta. This is the aorta, and this is the IVC. This is the IVC. Siddiquia. So, what is the location of this mass? Datna Siddiquia bhai. Now you see that the left lobe of the liver is it extends from the inferior surface of the left lobe of the liver. Left lobe of the liver. This is the longitudinal section of the left lobe of the liver, and this is the caudate lobe, the ligamentum venosus. Here is the mass. This is total is the mass, and there are no para-aortic lymph nodes seen, and this mass extends up to the umbilical region here. So okay, now no calcification is seen within this mass, and the spleen is normal in length from pole to pole, as well as the left kidney is normal. Here we see ascitic fluid. This is the postmenopausal uterus seen through ascites. Tiny calcifications are seen in this uterus. This is the urinary bladder. This fluid is representative of ascites. This fluid is also representative of ascites. So here upwards we can see fluid in the paracolic gutter. And this is the right paracolic gutter, and this is the left paracolic gutter. Here you can see fluid here. Ascitic fluid is there. This is small amount of fluid seen here. There are no lymph nodes, so this mass is in fact not relating to either the kidney or the gallbladder or the liver or the pancreas. So it's most probably a retroperitoneal mass with ascites. There we see. Now this is the transverse section of the ascitic fluid. See, this is the uterus in transverse section, postmenopausal tiny calcification seen. This is the transverse section. This is the endometrial canal central. This black area is all ascitic fluid. Thank you very much. This is the case of our day. Thank you.